Before we get directly into that, I want to talk a little bit too about histamine in general. So without being too complicated, this is histamine here. Let's change colors. Let's do, so here's histamine, and it's derived from the amino acid histidine. And so what happens is when you make histamine or release histamine, it can be broken down. There are different pathways which it can be broken down. It can go this direction. It can go this direction. This is one of the most, to the left is one of the most important directions. And this requires that enzyme. Remember I said earlier that diamine oxidase, that's the enzyme that helps break histamine down. You make a lot of this enzyme in your gut. So again, you also have it in your bloodstream, but you make a lot of it in your gut. So this is very important to understand. This is how, when we're being exposed to food allergens, a lot of times the histamine response within the gut, and DAO can help with that breakdown. Now, you come over here, you're going to see this. DAO requires, for it to work, it needs copper, which is a mineral, it needs vitamin C, and it needs vitamin B6. Okay, so you need copper, vitamin C, and vitamin B6. Without those three nutrients, again, vitamin C, right, which we're talking about, this enzyme won't be activated and you won't be efficient at breaking histamine down, and so that histamine level will potentially increase. Now, we also use gut bacteria to break histamine down. And this is what I was talking about earlier. A lot of times you go to the doctor, you got seasonal allergic symptoms, they think you have an infection, they give you an antibiotic, you wipe out your gut flora, and you leave yourself hanging. So imagine you're vitamin C and copper deficient, you got allergy symptoms, you get an antibiotic, they knock out your gut bacteria. That only really leaves you with one way to get rid of histamine. And a lot of people here with this HNMT, which is histamine N-methyltransferase, it's an enzyme that breaks and degrades down histamine. A lot of people have single nucleotide polymorphisms or genetic mutations where they don't do that effectively or efficiently, and so they're at a disadvantage. And so now it's like a trifecta. All the ways you can get rid of histamine are either genetically compromised or they're dietarily or drug compromised, and so here you are left with nothing but a bucket full of histamine causing a severity of reaction. So again, you know, this is what I was talking about earlier with copper, vitamin C, vitamin B6, nutrients necessary to degrade histamine. So coming back to, I think I showed you this already, but again, stinging nettle, bromelain, quercetin, NAC, and vitamin C are some of the safest, most natural antihistamine nutrition that you can bring into your body to help with this. So especially if you've done antibiotics and you can't undo them once you've done them, if you have a genetic SNP for that and you have low levels of nutrients, these are things, again, that can be used to help your body degrade and to regulate the inflammation caused as a result of that histamine response. Now I wanted to focus, I told you I was going to focus a little bit on some of the antihistamine effects of vitamin C. And one of the great researchers in this area is C.S. Johnston, has done a ton of research in this area, but just kind of paraphrasing some of the studies here. So the data indicate that blood histamine and plasma-free carnitine are altered in individuals with subnormal non-scorbutic vitamin C status. So basically, people with low vitamin C have higher blood histamine. And then this study also published antihistamine effect of supplemental ascorbic acid and neutrophil chemotaxis, which is how neutrophils move around. But the bottom line is histamine levels depressed 38% following vitamin C supplementation, meaning that when patients took vitamin C, it reduced histamine levels 38%. That's pretty impressive for something that you don't need a prescription for, that you can buy over the counter. And actually, I would argue that's probably more impressive than what you're going to get out of a lot of the over-the-counter remedies and medicines. And then you can see here, I showed you this earlier as well, but I want to highlight it again for those of you who are struggling with a gluten issue, and maybe you're not really, maybe you don't know whether or not you're gluten sensitive. In which case, if you suspect that you might have it, take our quiz. We'll drop a link into the feed. Look, it's a simple quiz. It's free. Take it. If you answer the questions, you'll get an answer as to whether or not there's a suspicion you might be gluten sensitive. If that quiz comes back and it's a yes, right, then you might consider getting genetically tested for gluten sensitivity and rule it out, because again, a lot of people struggle with seasonal allergies because they're also eating gluten. And a lot of people with gluten sensitivity don't take their diet seriously enough, and they fail to recover, right? And that's because one of the side effects of gluten exposure, gluten exposure can also lead to histamine release in the GI tract. And so that's just another important element of gluten. Okay, moving through a few more of these here. So this one, and this one's on intravenous vitamin C. Some people ask, what about IV vitamin C? Now, if you have the means and you have the resource in your area, some people say, well, what's better, oral vitamin C or IV vitamin C? Honestly, I think bang for buck, oral vitamin C is better, but you can also do IV. If you've got a good doctor who's willing to do IV vitamin C, you can do IV vitamin C. In this study, here's what they found. Our observations suggest that treatment with intravenous high-dose vitamin C reduces allergy-related symptoms. This was a study done by these doctors on 71 of their patients, and found that allergy symptoms reduced quite well with vitamin C. And then we have a couple more to show you here on this one. So this one is antihistamine effects and complications of supplemental vitamin C. I'll just point out a couple of things that, so this author of this paper was citing another author by the name of Chatterjee, who's a pretty well-known figure in nutritional research as it relates to nutritional immunology. So Chatterjee et al. Have postulated that ascorbate mobilization during stress may be a natural defense mechanism for the detoxification of excess histamine. So basically, they believe that the body releases more of the stored vitamin C to combat excessive histamine release. And I've actually seen this in a number of people with chronicity of allergy response, where when we look at their vitamin C levels, they're on the floor. Like they don't have storage of vitamin C, even their serum vitamin C levels, which I don't recommend serum measurement as a great degree of accuracy, but we've seen this trend where both serum and intracellular levels are super, super low, and those individuals struggle tremendously with allergies. And you see chronic administration. So what does chronic mean? It means daily, over time. But regular administration of 2 grams of ascorbate per day has significantly lowered blood histamine levels by 40% in healthy adults. 40% is a pretty darn good reduction in histamine if you're overloaded and overburdened. And then I wanted to bring this one up because I just thought this study was interesting, because some of you, this might kill 2 birds with 1 stone. Some of you might struggle with seasickness, so you get on a boat, you get ill. Well, there's research that shows that one of the reasons that seasickness is caused is because of a histamine release. And so this what's interesting about this study is they were using vitamin C to combat high histamine as a result of seasickness, and here's what they found. Some of the data show that vitamin C is effective in suppressing symptoms of seasickness, particularly in women and men younger than 27 years of age. So I think the takeaway here is, if you're young and you struggle with seasickness, you might consider taking vitamin C next time you go on a boat, next time you go on a cruise, and you might just get some benefit from it. And again, that works because seasickness is one of those things that can be induced by histamine release. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.